we're doing our teaching project for Nursing 406. I'm Nikki.
I'm Ashley.
I'm Allie.
And I'm Dylan.
And we're doing our project over women's health and screenings. So I'm going to read our objectives. Enhance knowledge regarding what a pap smear, HPV test, and HPV vaccine are for. Be able to incorporate knowledge of cervical cancer screenings into daily lifestyle. Plan appropriate interventions and evaluations based on knowledge of women's health screenings. And enhance knowledge of proper nutrition essential for women of childbearing years. Implement adequate nutrition into daily lifestyle. Evaluate effectiveness of learned knowledge regarding proper nutrition. Identify recommended guidelines for adult weekly physical activity. Describe the relationship between physical activity and bone health. Enhance knowledge about osteoporosis and the health screenings used in the diagnostic process. Enhance individual knowledge of STDs. Understand methods to prevent or reduce STD occurrence and to utilize STD facilities provided if an individual is thought to have an STD. So for the cervical cancer was what we'll talk about first after we give everybody a pre-test. We're just going to ask them what a pap smear is and explain what it is, as well as ask what an HPV test and an HPV vaccine is. And then we're also going to ask them and teach them about when you should get the screenings performed, as well as how often.
Okay, and then I'm going to talk about nutrition, and I have a few questions on the pre-test as well about nutrition. We all know how difficult it is to maintain a healthy diet while in college, and I'm sure many of us have struggled with this at one time. Busy class and work schedules, lack of sleep, and unhealthy temptations surround us on campus, making it nearly impossible to make healthy choices. Even though it's extremely difficult, a healthy, well-balanced diet is essential for the health and well-being of all people, especially women of childbearing age. ChooseMyPlate.gov is a free online resource that provides valuable information on what a well-balanced diet looks like. There's also a section on the website that's dedicated to college students and their specific needs. And then on our brochure we have the guidelines, like the recommended guidelines for women of childbearing age, like what their diet kind of looks like or should look like on our brochure. And it's very important for women of childbearing age to consume adequate amounts of certain vitamins and minerals, especially folic acid, vitamin D, iron, calcium, and vitamin C. And the recommended intake for those vitamins and minerals are on our brochure as well. These vitamins...
Come here.
These vitamins and minerals are especially important for women of childbearing age because they are required for the development of a healthy fetus. Because certain conditions develop during the first trimester of pregnancy, such as neural tube defects like spina bifida, it's important for women of this age range to consume adequate amounts of these vitamins daily. And then also on our brochure, there's a couple tips that I found from ChooseMyPlate.gov about how to eat a healthy diet while in college.
Alright, so I'm going to talk about physical activity and its influences on bone health. The first part of this is just talking about the daily recommended amount of exercise and per week that adults should get and the type of exercises that it should entail. And then the influence of physical activity on bone health. There are a couple studies that have been done talking about the bone mineral content and bone mineral density and how that applies to different physical activities and which exercises are better for increasing those two and which have no effect on it. And then also which age stages are particularly susceptible to changing your bone mineral content and densities based on your activity. And then talk about the consequences of decreased bone mineral content and density, which one of those is osteoporosis. So I'll go into a little bit of detail about what osteoporosis is and risk factors and signs and symptoms. Also the screenings that are done to test for different bone disorders, especially like osteoporosis, and also who and when people should have those screenings done.
Next I'll talk about STDs. I'll talk about common ones like chlamydia, gonorrhea, syphilis. herpes, HIV, HPV, hepatitis B, and hepatitis C. I'll talk about how they're transmitted. Then I'll talk about some of the symptoms and how most of them are asymptomatic. So if there is symptoms that you're experiencing, you should go get them checked out. Next, I'll talk about ways to prevent or reduce occurrence of STDs through abstinence, using condoms, vaccinations, or reducing partners. Then I'll talk about if STDs are treatable. Some are and some are not, so you manage the symptoms. And then we'll talk about STD recommendations on the testings of STDs, because some you should get more often than others. And then lastly, I'll talk about local facilities where you can get STD testing done. Like for a local one is the BSU Health Center and Women's Center, and there's a whole description on their website, and that gives the pricings as well. There's our conclusion. We'll also hand out a post test.
Thanks.